Hi Robert, how are we doing today? I know... Hi Robert, I hope you're doing well. I know that the news that we kind of gave you isn't exactly what you were expecting, and it all is sounding very confusing and very scary. I know that you probably don't know what aortic regurgitation and insufficiency is and how that is kind of applicable to heart failure. So I just really wanted to take the time and kind of explain it to you and kind of give you like a more detailed idea of what exactly is going on in your heart. And so kind of just to start off, I wanted to draw out the heart for you to kind of show you like what exactly the heart does and kind of how it's supposed to function. And so basically what happens over here on the right side of our heart is coming from our body. We have deoxygenated blood, so blood that we've already taken the oxygen out so that we can properly move our muscles and properly have body function. That is coming into the right side of our heart through something called the right atrium. And so this is just one of the 4 chambers that are in our heart. So this blood is going to come into our right atrium, and then it's going to flow down into our right ventricle, and then it's going to be sent up to our lungs. And when it gets to our lungs, that's when we're going to take a big deep breath in, and we're going to get oxygen back into our blood so we can send that back into our body. And so then when we have these oxygenated blood, it's going to go back into the heart. And so it goes back in on the left side, and it's going to flow through your left atrium into something called your left ventricle. And so then from there, from your left ventricle, this is where we're going to get that nice big old squeeze of our heart, and it's going to push the blood up through this giant artery called our aorta. And that's going to go to the rest of our body. So once again, we can have that proper tissue function, that proper body movement, because we're going to get that oxygen to where it needs to go. And so in a normal kind of functioning heart, what's going to happen is we're going to have this squeezing of our left ventricle, and our blood is going to go past up here. And as soon as it goes through this little spot, we're going to get these valves that close. And basically what that's doing is it's preventing the blood from falling back down, because we do have like gravity effects. You know, we can push this blood up, but we want to make sure it doesn't fall back down into the left ventricle. We want to make sure it's squeezing all the blood out. And so when we talk about something called aortic regurgitation or insufficiency, what's happening more so in your heart is when we go and we push out this blood and it pushes up through, these valves aren't closing. They're not kind of functioning the way that we want them to. They're kind of staying a little bit open. And so then when that happens, the bloods can pull back down and kind of pass through that area. And when it passes through that area, it's going to go back into the ventricle and kind of hit that wall. And so that's what we noticed on your physical exam, is that when we were listening to your heart, we kind of heard this extra noise, kind of this end systolic noise, and so an end-systolic murmur. And basically what happens is a normal heart would sound like lub-dub, lub-dub. And so the lub-dub are those ventricles kind of closing. They're like really closing to push that blood flow up through and then to your body. But in your heart, when we listen to it, it sounds like lub-dub, shh, lub-dub, shh. And that's because we're hearing those ventricles close, but they're not closing properly. And so the blood flow is coming back through into the heart, and when we hear that shh noise, it's because the blood is coming in and hitting that ventricle wall. And so that's one way that we were able to find that you had kind of that aortic regurgitation going on. And so another important thing to note is that when we are having this kind of regurgitation, we're getting this blood flowing kind of back into this left ventricle, is we're going to start getting a lot of blood flow, and it's going to start kind of filling with blood, kind of stretching it out. And so one way to kind of think about this is if we think about having like a water balloon, you know, and we're filling it with water, you know that when you start to fill that balloon with water, the edges kind of stretch out and they start to kind of really expand. And when they expand, we notice that the walls of the water balloon, they start to get really thin. And when the water balloon starts to get really thin, that's how we know that, you know, there's a potential that the water balloon is going to pop. Well, we don't want that going on with your heart, and your heart doesn't want that going on with itself. So to compromise for that, your heart is adding on kind of this extra tissue to the outside. You know, it's making it thicker so that when this starts to kind of expand, because we're filling it with more blood, you're not going to have a thinning like a water balloon. You know, we're adding more to the sides, and that's something called eccentric. That's going to be a type of like it's going to be a type of that's going to be, and so basically what's going to happen is that's going to be a type of like eccentric kind of remodeling of the heart going on. So it's kind of adding more to the sides. And so when it adds more to the sides, we kind of get, you know, this bigger heart, and it kind of gets a little floppier because, you know, you have all of this extra tissue on the sides. It's kind of like having to try to work a bit harder to, you know, eject this blood, but we're not getting the proper ejection that we want to. And so because of this, the type of heart failure you have is you're having a reduced ejection factor heart failure. And I know that it all sounds really scary. You know, nobody wants to hear that they've got this kind of larger heart going on that's not, you know, functioning the way we want it to, that the valves aren't staying the open in the way that we need them to. But I just want you to know that we have a really great team. You know, we're going to do everything that we can to just kind of treat you in the best way. And, you know, it's scary, but you have a great team, and we're going to take care of you. And if you have any more questions, you can go ahead and, you know, give us a little phone call, ring us up. But I really hope that this kind of helped to explain like a little bit more of what's going on. Okay. And I know